In this video, I'm going to be talking about standards of naturalness, okay? And what's very interesting about naturalness is I always tell my patients, your standard of naturalness is far too low for me. What does that mean? Does that mean you have no taste? Does that mean you have no judgment? No. But it means that you don't do this for a living, okay? And I'll tell you some stories to have you understand what I mean by this, and then I'll dive deeper into the philosophy behind this. But I was on I said this on several other videos, you may have heard the story already, but this is for people that are more interested in facial cosmetic surgery, you may not have heard this story about hair, but I think it's an interesting one. I was on a cruise in 2021, which is a couple years ago now. I'm shooting this in 2023 with my parents and my wife. And I saw a gentleman who's worth quite a bit of money who I could see he had a hair system or hair piece, and he had transplants in his temples, and he had some bad scarring in the back of his head. And you would think, oh, that's so obvious. That anyone could read a bad hair piece and a bad transplant. I've seen all of those walking around. And my wife, I asked her if she could see any of these things. She says, no, I couldn't see any of this. And I asked my parents, could you see any of this? And they said, no, I can't see it. And my wife, who is astrophysics, she majored in astrophysics and theoretical math at Emory because she said it was the easiest two majors because she didn't have to study. So she's obviously not an idiot, okay? She's incredibly smart. My mom is a real estate investor developer and understands banking back and forth like I don't even understand how she can understand it. My stepfather, actually, my father who raised me passed away in '06, but my stepfather is a retired urologist who's incredibly smart. And these are not idiots, okay? And they don't have bad judgment, they don't have bad taste. My mom has incredible taste. I think some of my taste has come from my mom. In fact, I know it has. My dad who raised me, who passed away, was also an artist. He painted and also was a physician. So I actually don't think any of them had bad taste or bad judgment. So why couldn't they see this? Well, it's not the hair piece you see like from The Sopranos with that guy down to here in a straight line. It's a hairpiece that was an expensive one. It just wasn't maintained, and there was a little bit of a weave that was exposed. I could see the insertion points of the temple. I could see the scars. Now, fortunately for him, no one on planet Earth could see it except for me or probably another hair surgeon. And my wife asked me a simple question. Why does it even matter if you're the only one in the room that can see it looks fake? And I said, because it's my art. Like when I do a painting, I'm doing a painting, believe it or not, for other artists to critique my work. Well, I think when a builder is building a house, I'm hoping he's building that house not for a client, but of course it's for the client, don't get me wrong, but it's for another builder. Because if I have a builder walks through another builder's home, he's seeing things that you will never see if you're not a builder. He'll see that the things are not leveled. He'll see that, boy, why did they do that? That's so cheap. And God, I can't believe they didn't straighten that out. This is what builders do. This is what anyone does. If you go to a shoe store and you're wearing some dilapidated shoes that are not, like your sole should have been fixed, and you're wearing a style that's 10 years outdated, and your leather has not been maintained, or that your shoe doesn't fit right, that person who sells shoes or works on shoes, a shoe cobbler, whatever it may be, will instantly see how bad that shoe is. You may never even see 1 ounce or iota of that problem, but they will see it. And the reason I see these things is I spend 8 to 10 hours on this on a daily basis. Here's another story. And this is a facial surgery. I had a lady that was pre-opping. What pre-opping means is she's here 2 weeks before for a pre-operative evaluation when she gets photographs, she signs consents, she goes through the instructions and signs off on everything. And she said, Dr. Lamb, I'm really scared about this fat graft you're going to do. And I said, why are you scared? She says, because I don't want to look like Meg Ryan. I don't want to look like with big cheeks and artificial results. And I said, I hate to tell you, and you already sort of look like Meg Ryan right now. She was overfilled in the cheeks, and I needed to dissolve everything before I could actually redesign her. Now here's a woman who's deathly afraid of looking fake, and she can't actually see that the exact person that she'd not want to look like, she looked like. Is that because she was unreasonable or had body dysmorphic disorder or was borderline crazy? No, she's a salt of the earth, down to earth, really nice woman who really has good judgment in general. I'm sure that I would trust her if she sold real estate to sell me a house. I'm sure that I would trust her if she was doing something else in her line of field. But she doesn't do this for a living. She can't see that she has distortion, okay? And so I dissolved all her fillers. I restructured her, and a year later, she's like, oh my goodness, I can't believe I look fake. I had another lady that comes from either East, from East Texas. And I said, look, hey, I don't know if you know that your lips don't look natural, and I would really like to dissolve them. So she said, no. And I mentioned this a couple times because I am a little bit aggravating. I don't like things that look fake. So if you do look fake and you really don't like standards of naturalness, you just love to look overdone, please don't come and see me. Don't set up a consultation. I'm sorry. I'm not interested in making more money. I'm interested in doing the right thing for a patient, and what right thing for me is naturalness. So if you love looking just a little bit overdone, don't schedule the appointment. And I'm being very serious. And I always tell my patients, I'll finish the story in a moment. I always tell my patients, I'm so appreciative of referrals. I'm so appreciative when I'm honored that you would send your friend trusted to come to see me. But I always say this, I've probably said this 10,000 times. I said, the only friend I do not want you to send me is someone that looks overdone, that wants more overdone work, because I'm just not going to do it for them. I'm going to tell them what looks fake. I'm going to dissolve it. We'll have a very, very acrimonious relationship. It will not be a fun one, because I will tell them what doesn't look right. And I will do that to you. If you come in and you think, look, I look great, I'm going to tell you things that don't look quite right. And it's not because you're not smart again. It's not because you have no taste. It's because there's a distortion that occurs that you don't know doesn't look right. Okay, and you can't tell that it looks wrong. So to finish the story, is this lady finally said, Dr. Lamb, I want to dissolve the lips. You told me to dissolve them 2 or 3 times. I want to do it. I'm going to do it. So I dissolved her lips with a dental block. There's no pain when I do it. And she told me, I think a year later, she said she was very, very depressed for a month that she made this choice to dissolve the lips. She thought it was a wrong decision. She did not like the fact that her lips looked deflated. It took her about 2 months to finally see that all of her friends looked fake. Wow, here's a woman that really probably prided herself in seeing how people look right or wrong. But she was depressed with her choice, but finally realized she looked crazy, and she could not tell she looked crazy. And that's a normal, wonderful human being who is not interested in looking fake. And you said, well, how can you not tell something looks fake? I mean, I have the judgment. You can look out there. There's 2 reasons for it. The first reason is, as I already mentioned, your standard is way too low. Okay? You actually will, if you're at a party, you'll see 5 women or 5 men that you think, wow, they just look absolutely outrageously fake. But I will look and say you've missed about 10 of them, because you don't do this for a living. You don't spend, it's like the shoe cobbler, okay? The second reason is what I would call progressive distortion. And so people come in, they get a little bit of work, they sort of like it, and then they want more of it, and they want more of it. And to be honest with you, that first move was either the right thing or the wrong thing, but more in that same area will cause problems. And some of it because they're trying to address the left brain problem. I think I said this in my last video, but I'll repeat the story. Is this woman came to me from Austin, Texas, that said, hey, my lips never work. They always fail. I go, I think I know why your lips have failed, because you are striving for a actually perfectly symmetric lip. So watch my other video about left versus right brain to go in more depth with this. I already knew her problem. They should even state it to me. But she was trying to get her left and right sides exactly symmetric using left brain work, trying to get it perfect. And she just kept on chasing it until the lip looked crazy. And she didn't even know her lips looked crazy until I told her she needed them dissolved because they were overdone. So I think one of the reasons why there is a problem is there is progressive distortion, where someone just a little bit was fine, a little bit more is better, and then it gets worse and worse because they can't see that they actually start delving into the distortion level. The good news is I'm never going to give you that option. I'm not going to say, well, oh my God, you picked wrong, you went a little bit too far forward. The fault shouldn't be with the patient, to be honest with you. It's the fault of the surgeon or the physician or the cosmetic injector who just really doesn't have good enough taste to be doing what they're doing. Recently I did a hair transplant on a gentleman, and he said, hey, I don't want my wife to look fake. That's why he was afraid for her to do a facelift or a fat graft, and I had to bear the news to him, which is unfortunately she already looked fake. Her lips were overdone, her cheeks were overdone, and all from bad distorting fillers. So there's a natural thought with fillers is that, oh, so if a little is good and a lot is too much, then I should really just control myself, find a good doctor, and just do a little bit of fillers, stop, come back 10 years later and do more. And here's the truth. With anything, with facelift, fillers, brow lift, whatever it may be, a lot of people are worried that I hear this. In fact, my nurse this morning, I heard them during my surgery say, oh yeah, they just did too much. And I will tell you that I can do a lot. I can do mesobotox every 3 months. I can do Botox every 3 months. I can do 30 syringes of fillers. So, well, my God, 30 syringes, that's got to be absurd. The person's got to look like a cow balloon and look crazy. I can do a facelift. I can do a rhinoplasty. And guess what? They're not going to look overdone. You say, well, wait a second, back up. You just said 30 syringe of fillers. Do I need that? No, most people, over time we can add up. The trick, though, is to put it in areas that don't cause distortion. So you put it in your lips and cheeks. You can't tolerate more than anything. I don't even put anything in anterior cheeks because it looks crazy on people. When they smile, it looks like a big ball. The lips, especially if you're getting more mature, can tolerate very little in the lips. So the trick with this is understanding in certain zones you can use more. Now, you said, well, what is 30 syringes of fillers? Well, actually, to tell you the truth, if you just think about it, and you may not know this, each syringe of a filler is 1 milliliter, okay? A milliliter, if you add 5 milliliters, you get 1 teaspoon. So if you do the math on that, 30 milliliters is 6 teaspoons. That doesn't sound like a lot, does it? But I will tell you, I've had patients that come in with 1 syringe that look outrageous, crazy. I had one lady that didn't want to dissolve her fillers. She had 3 syringes done in Los Angeles, and she looks outrageously crazy. And I told her it does not look good, and she did not want it dissolved. And you know how I fixed her 3 syringes? I used 9. You say, well, wait a second. How do you pack on more garbage to make someone look good? You don't. What you do is you balance it. So if you're, like the lady I told you about, and the other, maybe I said, I saw so many videos, I don't remember which video I'm saying, but if you're front heavy and you don't want it dissolved, I rebalance the outer face. And to give you understanding, when I do fat, this morning I did 28 cc's, 28 milliliters of fat, and this woman will not look overdone at all, okay? Because I do it in areas that are safe, dynamic issues where you're smiling. Do not put fillers here, do not put fat here. I know that what's interesting is the 2 areas that other injectors absolutely love to do are anterior cheeks and lips. That's rarely what I do. I just think they look crazy. I do lip lifts, I will put fillers in the lips, but I do it in a tasteful manner, and I won't do too much there. In the anterior cheeks, I rarely fill that. It's what patients love elsewhere, and they just keep on getting jacked up. So I can put quite a few syringes in. I can do a lot of Botox. You're not going to look overdone because I do it with taste, and I know where to structure it. I can put fillers in the earlobes, and I put a half a syringe. The lobes look great. People, I don't need that. I put it, oh my God, I look great, and it looks balanced. So understand, I have the judgment to help you, and my standard is incredibly higher than yours. And if it doesn't make sense to you or it sounds arrogant to you, really take a step back and think about the analogy that I used about the shoe salesman or the realtor or the contractor, the builder, whatever it may be, whatever your expertise is, that's what you do well, and that's what you know better. A great example is I have a financial advisor. Do you know how many times I tell him to pick a stock and do this and do that? Never. Okay, never. I may say, hey, have you thought about this? Have I heard this trend? But I'll let him make the judgment. I'll let him put in what he calls a dry powder, which is the cash at the right time. I won't get in his face and tell him, you better do this, do this. You know why? Because I don't do this for them. I don't spend 8 hours thinking about the market. I don't think about where to put my investments. And the most dangerous thing is the doctor trying to dabble and try to tell everyone else, hey, this is how I'm going to play the market. This is how I'm going to do. Well, also when you come in, I'm going to give you advice. Or an attorney. If I work with an attorney, I will tell them this is what I would like, but I will ultimately listen to the attorney because the attorney does this for a living. So I jokingly call myself a facial financial advisor. I will help you look better. But that's the key, is to understand is that I want you to look as natural as possible. And if you're afraid of looking unnatural, don't. If you love looking unnatural, please don't pick me, and do not schedule a consultation. Please cancel your consultation. I do not want to see you. I will not be happy with you, and you will not be happy with me, and we'll have a very, very, very adversarial relationship, and it won't be good. But if you want to look natural, take a breath and understand I'm not going to make you look fake.